I'm Dr. Donna Gfeller, clinical psychologist and director of the Departments of Psychology, Psychiatry, and the Knights of Columbus Developmental Center at SSM Health, Cardinal Glennon Children's Hospital. I also have an appointment as an adjunct assistant professor in the Department of Pediatrics at St. Louis University School of Medicine. At the Knights of Columbus Developmental Center, we basically see patients who are ruling out for diagnosis of autism. We provide care as kind of a multidisciplinary team, so we have physicians, psychologists, speech therapists, OT, social workers, family resource specialists, which is amazing to have all those staff to support our patient care. So it's a great group because it really allows us to be able to have comprehensive evaluations that aren't necessarily typically available for children with autism. When I see patients, therapy and things like that, I typically involve both the parent and the child. So I always greet them together, invite them back to my office. I usually start with the parent first, engage them in conversation about why they're coming here, what can we do to be helpful. Typically there's things in the office available for children, like whether it be books or toys or activities. And obviously this varies by the child. If it's an adolescent, it would be really different. But really, my goal is to, by the end of that initial consultation session, to really make sure that I understand the child and I understand the parent. I spend an equal amount of time talking with the child, and just I need to know, what's going on in your life. How are things at school? How are things at home? What are your favorite TV shows? Who are your friends? I just want to know anything that they want to share with me. So I really think it's really valuable by the end of that initial session to know that each parent and child feels valued and that there's something of benefit for them for therapy. I keep coming back to Cardinal Glennon, I think mainly because of the patients, because you really realize, whether you're the director or a staff person or the front office, that you actually really make a difference in that child's life. And particularly as a psychologist, you're really helping children with emotional behavioral disorders, but you still see that children are so resilient that you can really make a difference in their lives, and it's amazing. And I also I think what brings me back to Cardinal Glennon is our coworkers, because many of us have been here a long time, and even those that are not, we still all kind of consider ourselves family.